I'm going to go ahead and get started and introduce our speaker for today. So her name is Carolyn Daher. She is a public health specialist with over 20 years of experience connecting research, education, and figuring out how to implement that to build healthier communities. She's got her bachelor's in environmental studies from Brown, her master's in public health from Johns Hopkins, and a master's in psychosocial intervention from the University of Barcelona. And her talk's going to be really interesting because her work centers on how to generate greater impact in policy and society using scientific evidence and ensuring evidence-based practices in the creation of projects to promote health, especially in the urban context. So she's going to talk to us a little bit more about that. And she's currently coordinating the ISGlobal's Urban Planning, Health, and Environmental Initiative. So we're pretty excited to have her come talk. Before we get started, I just want to give a little plug for next month's seminar, always that last Thursday of the month on March 28th. We're going to have Dr. Becky Hardman. She's with she's a wildlife veterinarian with the Florida Fish and Wildlife Conservation Commission. So down in Florida, she does specifically some herpetofauna, avian, and aquatic species work. So she's going to be talking to us. She actually is a UT alum and was the previous One Health Initiative postdoc. So we'll be excited to have her. But for now, we're going to tune in to Dr. Daher's talk here. And I'm sure that she'll be happy to take questions at the end. So be sure you're writing those down, or you can put them in the chat too as well, if that's easier. So we'll go ahead and get started. Thank you, guys.
Thanks. It's a pleasure to be here today. And if you do want to interrupt me or chime in at any point during the talk, we can go for that as well. I don't mind being interrupted. I will confess that I have a lot of material to go through, but I will make the slides and everything available afterwards so that you can consult. And also on our website, we have a lot of information. So thank you to Alyssa also for getting in touch with me, and to Ashley for having me here today. And I will now, I think, share my screen with you. Let's see. There we go. Everybody see me okay? Yep. All right, yep, great. Okay. So in this seminar happens only once every 4 years, right? Because it's February 29th. So that's exciting. So I'm going to start out just, what is the context that we're in here? This is the first time in human history that most people are living in cities, and a lot of them living in really poor and kind of unplanned conditions. So this demographic shift has also been accompanied by an epidemiological shift where more people are living in urban areas, living longer, but also living with more chronic disease. So we've seen a transition away in many countries, especially the United States, from tropical diseases and kind of infectious diseases to these chronic diseases. So you can have people living many decades with one or more significant health issues. And so that is something that we're interested in examining because the costs of this are really high, socially, personally, and economically. So to start at the beginning, what is it that we think of health? If we were together, I would ask you this, but I'm just going to give you the definition now. Is that it's a complete state of physical, mental, and social well-being. So we're not talking about something that's limited to the health system or whether we're sick or not. And if we kind of embrace this holistic vision of what it means to be healthy, then I think we can understand that our health is determined by what we call the determinants of health, these many, many, many factors in our surroundings. In fact, most of our health is not determined by our genetics and who we are, but it's determined by all these other factors around us that then can trigger things in our genetic and individual profile. But we're talking about, a wide group of things. And in fact, the environment that we live in this case, many people now, the urban environment is almost a quarter of our health. It determines almost a quarter of our health. So that is a huge opportunity for us to think about what do these environments look like, and are they giving us health? Are they giving us the conditions that we need to live healthy lifestyles? We know that cities, for instance, also exacerbate health inequities and inequalities. And so we need to pay a special attention to this. Equity is a word here. It says inequalities, but it should say equity, I think if we don't really make sure at every step of the way that we're thinking about who our policies and practice affect and the distribution of this and kind of the empowerment structures, we're always going to fall short, because a lot of the things that we do, unfortunately, don't end up helping the people that need it most, or can cause different consequences. So what are we looking at here? You're probably saying roads, traffic. Maybe we think about the things that it might impact us, from this situation, like sedentary behavior, air pollution. But fundamentally, what this situation is public space, and public space in Tennessee. So this is what we are using our public space for. And I think that we can see that when we allocate most of our public space to situations like this, we might be willing to say that, yes, this causes traffic, and traffic has a lot of consequences in terms of lost money, lost time, frustration, and some other things. But fundamentally, also, this situation of how we're allocating our public space is related to the urban planning model that we have, the mobility model that we have, and then create some real health effects. So in this model, for instance, we're going to have a lot of air pollution, we're going to have more heat, and we're going to have a lot of noise. And these are things that are detrimental to our health. They don't promote health. And at the same time, because this is what we're doing with our public space, we're not allocating it to green and blue spaces. We're not allocating it to social contact or physical activity, which are things that actually help keep us healthy. So one of the things that we think about is that a lot of the drivers of our health come from outside our health sector and come from this environment. And unfortunately, right now, in many cities across the world, almost all cities in the world have unhealthy air. And many cities of the world have these conditions that the model now, which when it was created, this model probably was created by people who were trying to satisfy the needs of the time. And it surely was well-intentioned and probably made many of these. But this model now of urban mobility and allocation of public space has become quite dysfunctional, because the negative impacts outweigh most of the positive impacts that we could have. And so in ISGlobal, we look at this from this standpoint of the environmental exposures. Now, these are not the only ones. These are 5 that we look at. There are things like waste management and housing and nutrition that could go in here, but this is what we focus most of our research on in our department. So I'm going to go into these. And so what we would like people to understand is that the conditions that we create the urban model with lead to these exposures that then pretty much impact all aspects of our health. So I'm going to go through some of these. Air pollution worldwide is pretty much an epidemic. It kills over 7 million people worldwide every year. This is outdoor and indoor air pollution, and it's one of the major causes of death. And this is gases like NO2 and then particulate matter. And this comes mostly in many of our cities that are not heavily industrial from the motorized traffic. And this is the distribution of this every year and kind of the deaths that are attributable to this. So we're not talking about small numbers, right? And yet somehow this is a situation that we've kind of come to accept as normal. I don't know if most people know that air pollution is a major contributor to lung cancer right now. These are data from the EU, but as smoking thankfully has gone down in some places, the proportion of disease attributed to air pollution has gone up. And this is problematic because, this is not something that an individual chooses to do or not. Air pollution is all around us. If we live in cities or we live where people are driving cars, then we're exposed to this, and it's very difficult to choose. Smoking at one point, when smoking was permitted everywhere, again, put people in that situation, but now that's mostly been controlled through policy and rules. But we don't have that for air pollution yet. And yet, actually, the biggest contribution in terms of ill health to air pollution is the cardiovascular system. So at this point, we know that all aspects of life, all phases of life, and every system in your body, from your vision to the possibility to develop Alzheimer's or dementia, to reproductive issues and smaller preterm babies, these are all things. So there's no period of your life when air pollution is not generating negative health impacts. And the WHO in 2021 did a review and drastically reduced the levels, and most cities in the world do not come close to meeting these. And so we have this situation worldwide, and these are just some of the consequences. Like I said, just an example. Schools, kids in Barcelona who go to school is a more polluted area have poor performance. Their ability to learn, their ability to work, their memory is impacted. And this is just 1 year. The good news is that this can be reversed. But here you can see how we're creating inequity because children don't usually choose where they go to school, and the environmental conditions in which they're in affect their ability to learn. And yet they are a population, that doesn't vote, that doesn't have a voice, and, merits protection. Noise is a very underestimated health impact related, again, to what's happening in our cities, mostly related to traffic. And again, it's not just about hearing and hearing loss. There's indirect effects on hypertension, diabetes, and even when you can kind of tune out the noise, your body is still feeling it, and it activates inflammation and hormonal responses. And especially in terms of the mental health impact, in some cases, it can be even greater in terms of disease than air pollution, disease versus death, because of this annoyance and the inability of people to sleep. And it creates this kind of vicious cycle of ill health, economic loss, you miss work. And so, again, it's a very underestimated and under-addressed public health problem. And we see, again, if we look at schools, the combination of air and noise pollution, can be created to be attributed to affect the way children learn and behave. Physical activity is another area where there's been a huge paradigm shift. I'm sure all of us remember, the WHO guidelines that we are supposed to go to the gym 3 times a week and suffer for at least 30 minutes trying to get our heart rate up. And, they still want you to do that, but actually there's been a huge paradigm shift within the last couple of years. And now they talk about every move counts. Most adults in the world don't get enough physical activity. And we need people to be moving more, period. Standing up. In California, they say sitting is the new smoking, right? We need people to be moving more in a variety of activities. And here is just an example of, walking. We are designed to walk. We're designed to move like this. And this is what happens in our brain. In addition to the physical activities and heart rate, it actually stimulates our brain to move and walk. And yet many people, especially in the United States, do very little walking every day, again, because of the way that our urban fabric or the way that our cities are designed that promotes using motorized and individual transport that doesn't encourage walking. And so if we want people to be moving more every day in a sustainable way, like not necessarily having to go and seek it out as a special extra activity, again, nobody's going to encourage sports and gyms, but we want people to be able to move more, period. So we need cities, we need designs that help people walk more and move more in their daily activities, right? So going to and from school, going to and from work, doing some shopping. Maybe not all of the trips can be done this way, but at least some of the normal things that we do in our day-to-day life. If we can get them in active transport, we're making huge gains in public health, and it's sustainable because we're not asking people to do something extra. And again, the design of the cities is super important here. Green space is another very important area for many of the urban challenges. And I think, especially for the One Health and probably many of you here, this will be of interest to you. Green space and nature are one of the key allies that we have to combating many of the urban challenges that we have today. Our cities don't have enough nature in general. They don't have a good distribution of this nature. And this creates both inequity and also leads to premature deaths. And so even cities that we might consider green because they have a few large parks, if we apply a health impact assessment where it means that you really need to have green close by people to be seeing it and accessing it all the time, we see that many cities are deficient. It's not just about having a few large parks. People need houses, need to be able to see trees from their houses. They need parks nearby. They need green on their streets. And oftentimes in urban contexts, that doesn't happen. The benefits of green space, the multiple benefits, are now quite well documented in the literature. The last 10 or 15 years have seen a lot of increase in the data around this, and they are multiple. And again, kind of like air pollution, in almost every facet of our life, along the life course, in different systems, we see that access to nature can be beneficial. These are some of the pathways that this can happen. And you see there's, the biodiversity and kind of the conditioning of the environmental exposures that makes them cooler, reduces noise and air pollution, but then also promotes physical activity. When we're in nature, we tend to move more, we socialize more, which is very important for our health, social contact, for mental health and stress reduction. So there's a number of ways that we see that nature can be really beneficial and yet can be very sparse. And these are just some more of these. For kids, it's very important, for their fine motor, for their gross motor skills and their development, for their autonomy and their self-confidence, that they have access to nature. Likewise, we have older populations, and yet our cities and our environments are really not designed for these elderly populations. So how can we be creating cities and places where older people can live well and enjoy health, even in the face sometimes of living many, many years with different chronic diseases? And green space can give a lot of these benefits. So it's a good investment for kind of a broad range of people. And then we know from the pandemic, and even the Surgeon General in the United States has pointed out to loneliness and mental health as a real health crisis, in the United States and certainly worldwide. And here we see, this is a health impact assessment we did in Barcelona that showed if we, greened every third street, we could accrue pretty significant mental health benefits. And the important thing here is not only to show that this, increasing of the canopy, increasing of the green had important impacts on mental health, but it was also related to significant savings. And so, one of the things that we find with nature in cities is that, people say, oh, this costs too much. It's going to cost a lot of money. We have to maintain it. But that's because these costs are they're presented as a cost when really it's an investment, because we're not accurately calculating all of the ecosystemic and health benefits that really come. So these algorithms and the spreadsheets, I'm not an economist, but I know, because I've sat in the meetings, we're kind of, you put in the data and somehow putting more roads and parking spaces always comes out. And I think that's because the algorithms and the spreadsheets are a bit broken. They don't really include the full range of costs. And here we can clearly see, if we do the analysis a little bit different way, we see that trees make health sense and they make economic sense. So being able to make the case that putting nature into our cities is a valuable, sustainable, and cost-effective health intervention is a very important way to frame this discussion, because treating people when they are sick, especially in the United States, is extremely expensive. Treating illness, and we have too many people living with too many illnesses for many, many, many years. So how can we begin to look a little bit more about prevention, to look a little bit more upstream, and how can we promote health and keep people from getting sick? We don't need to address many of the issues necessarily more medical interventions. We need to be looking at how the environments can be giving health. We don't want to forget, when we talk about nature, people tend to think about green space, but we don't want to forget about blue space, because it also is very important. The scientific literature is less consolidated. We can say less certainty what are the health benefits for blue spaces, but the evidence that is out there points to the same tendencies and general direction of blue space. So, I think that should definitely be included when we talk about nature. And then, of course, climate change. This is it's kind of looming over us. As my friends who are in Wisconsin say, yesterday it was -5 and today it's 70. We don't know what's happening here. I mean, we're all feeling this: the floods, the fires, the storm bombs. We feel it more and more now, and this has kind of become our new normal. And no continent, country, or community is immune from this. And these climate events have serious health implications in a variety of ways. So when we talk about climate change, it's important to understand that climate change is one of the #1 health problems we have at this time, and it often is not talked about in that way. Climate change is a health crisis. And these are some of the pathways. This is kind of a busy slide, but I very much encourage you to go to the Lancet Countdown. Unfortunately, it doesn't give you kind of localized indicators, but it will give you some very good data on kind of the general level of what's happening for climate and health. And these are just some examples. The Wellcome Trust has some nice statistics about this, but why we really need to be centering climate change around health as well, because hot weather makes all health issues worse. Oops. Oh no. How did this come in Catalan? Okay, sorry. This says hot weather makes everything worse. The climate change is affecting our climate, our food security. Climate change is making infectious disease transmit more rapidly and more efficiently, and reaching net zero emissions is cheaper than any other alternative. Sorry, I do not know what happened there in the middle. So this is just an example on, they've done some calculations. They have all the data sources here. I encourage you to go explore, but in the United States, the number of deaths caused in a given year, this is for 2021, and the costs of these. So again, these are not insignificant numbers of deaths. These are not insignificant costs that we are accruing because of the connection between climate change and health. And here's just some of the same data if you look at floods, the number of people that affected is quite large. We see for the United States by floods, and then the damage that it's causing is very big. So being able to tie these agendas together and really realizing that we need to address climate change because of the health consequences, and that, you know, most likely the economic costs that we need to invest to address climate change are going to be offset by the health benefits that we're going to accrue. And we need to be calculating that in that way. This is just another example. The urban heat island effect is something that happens because our cities have a lot of asphalt. They had a lot of dark surfaces that are impermeable, and they attract heat and then they radiate them. So you can find these differences of temperature that are not insignificant between the urban center and the periphery areas and the peri-urban areas. And for instance, in European cities, which are more dense than United States cities, but this can cause up to 4% of summer mortality, even in the absence of a heat wave. So this is just normal summer temperatures. And the heat wave, it gets much worse. But we see, again, increasing nature, in this case, tree cover, can be a very effective, cost-effective, and environmentally effective way to address the urban heat island effect. Heat affects children. We tend to think of this as something that's affecting older people or vulnerable people, but it does. During heat waves, emergency room visits for children go up. They can't learn as well. They're in school. And so, you know, we don't want to underestimate. These are our vulnerable populations, and we need to be paying attention to the impacts that they're having on these. And then social connections. You know, again, the mental health crisis, a huge portion of the population feels lonely. And this is not even to get into the other mental health challenges that we have. So how can our urban environments be designed to address all of these issues? Well, in Barcelona, this is a picture of Barcelona from the air, and this square bit is called the Eixample. It's very iconic, and it was designed by Ildefons Cerdà in the 1860s, and he understood the connection between urbanism and health. And so this design was calculated through light, airflow, and everything to promote health. And the thing that didn't happen here, it wasn't designed to be roads, because at that time he envisioned some kind of mass transport, but he thought it would be carriages or trolleys. He didn't envision cars. But every interior of these courtyards, you'll see, was supposed to be green. And unfortunately, that didn't happen through speculation and interest. One or two of them you can see in here are green, but it was supposed to very much bring green space into everybody's living situation. And so this is an example of a design that was meant to promote health and address some of these issues. If we do a health impact assessment for environmental exposures, we can see here that these exposures that worry us in terms of their significant health impacts very much correlate with the road infrastructure. Green space is darker because it means darker means less green space. And so we see it pretty much lines up where the roads, where we're giving more of our public space to roads and traffic, is where we're going to be worse off. And if we calculate this, it's not an insignificant number of deaths each year, almost 3,000 premature deaths. And this is how it lines up the mortality. And then if we look at morbidity, which is disease, we see that noise jumps up for what I mentioned before. But, you know, again, including this kind of analysis and awareness that when we're doing our urban design, it's going to have significant health impacts is important. So these are our problems. These are some of the challenges that we have in our cities. And loss of biodiversity, for instance, is also a huge challenge. The impacts of that on health are starting to be better documented. I'm not going to go into that today. That would be maybe a different seminar, but those are also there for sure. What can we do? Well, we have the SDGs, for instance. And, you know, I think SDG we have SDG 3, which is about health. We have SDG 11, which is about cities. But if we take a more holistic view, I think we can see that urban health is related to almost every single one of these SDGs. And so maybe instead of, you know, kind of separating out, we need to understand that this is actually a very transversal element that needs to be addressed in all of these different areas. One Health certainly gives us a framework to try and understand the different interconnections between the environment, human health, and animal health, and the implications on health. It's not the only framework. For instance, the planetary health framework is out there, is probably a little bit more common in the medical community. Planetary health claims to encompass also One Health, but really we see the need to shift from this idea that we're individuals and even public health to really embracing the concept, which is at the heart of both planetary health and One Health, that if we are not providing a healthy environment, we will not be healthy. The linkages between the two are fundamental and cannot be undone. So policies and practices that are detrimental to environmental health are detrimental to our own health and therefore prosperity and well-being. We have concepts like the urban exposome, which might be interesting for you in academia, because this is an attempt, and a lot of the research that's to date, one of the challenges that we have is that we do individual exposures at a time, and we don't consider multiple exposures kind of happening in different locations, where you work versus where you live versus where you're moving around. And so the exposome is a concept that's being developed within research to try and have better, through the use of omics and more sophisticated data collection and analysis, to merge these to see if we can get a more holistic understanding of how all these different factors together can be related. This isn't really user-friendly in terms of the policy at the city level yet, but certainly within the research. And there are some large projects who've been trying to look at this, and certainly methodological advances are being made. From our side, this would be kind of a simplified conceptual framework that we like to use to show that, again, we look at the features of the urban design, the way that our cities, in terms of density, mixed land use, the connectivity, these are going to condition our individual behaviors that are then connected to these pathways of exposure that then are directly related to the amount of disease and mortality that we're going to have. So if we intervene on the pathways or in the disease, the medical system intervenes on the disease and the mortality. But really what we need to be doing, and we can even sometimes try and intervene in the pathways, for instance, by putting a noise filter or putting an air conditioner on our health. But we're still kind of only midway there. And where we really need to be looking is at these first two categories. And we can try and change individual behaviors. All of us have probably been to the doctor, and the doctor gives us a list of things that we need to do: eat better, do more exercise, sleep, and whatnot. But kind of the point is, that's all fine and well up to a point, because if your neighborhood or your environment doesn't facilitate those things, it's really, pretty unfair to be asking you to be doing those. You can't eat fresh food if you don't have access to it. Especially if you're from a vulnerable population. You can't walk if your environment is totally hostile. My mother's family lives in a neighborhood in Wisconsin, and there literally are no sidewalks, literally none. So you can't even really walk safely anywhere. Sometimes we walk places and people stop their car and ask us if we need help. And that is the reality, right? So our environments are created in a way that really, really makes some of these healthy behaviors challenging to us. So what are some of the things that are going on kind of worldwide to address these issues and pull these things together? This is a great initiative being done out of Australia. They've really done a lot of work through RMIT University, and they put together this whole platform of healthy and sustainable cities and these scorecards. And there are some more cities in the United States being planned to participate, but right now there's only a handful. And they try and give indicators from the kind of urban and planning and policy side that then are related to health, and show on a scorecard how these are all play out. So for instance, we can look at Baltimore, and then they also have one for Arizona, and we can see, the differences in the urban environments and the access that people have to different features. And we can imagine the health consequences that those are going to have, right? We see that access to fresh food is a real challenge in both of these cities. But connectivity, for instance, is much better in Arizona than in Baltimore. So I encourage you to go and visit these sites and think about, in your own cities, how that might be, what some of those characteristics might look like. And then we have frameworks like Health and Health Policies, which is the CDC uses it, and definitely some states and some local planning governments in the United States have used this. It was an approach developed mostly by Canada, who's been always forward-thinking in terms of public health and determinant of health, that says that health needs to be in policies. Health needs to be in transport policies. It needs to be in housing policies. It needs to be in energy policies, because all of these different things, housing is a health intervention, mobility is a health intervention. And so it tries to get health as a transversal element. And this requires working in a really different way that many administrations are not prepared or don't have the capacity to do. So this is just some examples. But again, this is from the United States, this framework. And then, we really need multi-sectoral approaches, that would be related to health and policy to address these issues. We can't be working in silos the way that we do, where the health department works in one way, but it's not connected to businesses or architecture. And that way of working really doesn't produce the environments or the results that we need. We also need some pretty big paradigm shifts. One of the big ones in our mobility, the United States is really, really far from this in many places. A few cities, but not many more. And we need to vastly invert this pyramid where private vehicles are not demonized, but they are the minority of what our public space in urban environments looks like. Sometimes the car is the perfect way to get around. Certainly if we're going to IKEA or needing to go friends or want to go on a trip, but especially in urban environments, we need people to be walking, and we need to have the environments that make that safe and accessible and efficient, and then combined with public transport. This is just a health impact assessment to show, that we can get large health benefits when we move to more active transport. And active transport includes public transport. And the only times that we really see that it would have negative impacts is because of accidents. And again, that is almost exclusively a result of having inadequate infrastructure when the urban environment itself doesn't let people move safely in cycling or walking or other transport methods. We need to be very aware that some of the solutions being presented, although there's some backpedaling going on right now in electric cars, but these are only partial solutions, and very rarely is the technology itself going to be our ultimate solution. Despite the fact that we have a lot of greenwashing and kind of businesses who get behind these things and kind of try and position the technology itself as the solution. Because in the example of electric cars, if we woke up tomorrow and every car was electric, that would be great. In the sense it would be part of the solution, but it would also be a disaster because we are getting no reduction in some of these other areas. We're only getting a partial reduction in air pollution and noise, and we're getting no reduction in things like injuries, heat island, and physical activity, and lack of nature in our cities. And this is, we need the whole package. So as I was saying, health impact assessments, maybe many of you are familiar with environmental impact assessments, which can be quite common. The same methodology, more or less, exists for health, but it's not very common. And this is a way to compare different scenarios, different policies or different interventions, and understand what the health impacts of those would be. For instance, in Barcelona, we did this study on the superblock model, which was a change in urban model that they were trying to be pushed through, which basically is a greening and pacification. And we were able to see that, yes, in fact, that if we were to transition to this model, we would be accruing health benefits. So the urban model, once again, is a public health intervention. What had been done in Tennessee? Well, you do have some examples here, some limited examples of health impact assessments. And we can see that some of them are centered around, in fact, these municipal planning and sustainability and transport. And so this is a good direction to go to kind of get this type of methodology included more and more in the policies that we're doing. And then we have concepts. This is a quite new one, like the 330-300, which is a way to bring green into our cities. Most cities in the United States might score very well on this because of urban sprawl. But the idea, again, is that green space just needs not to be in cities, but it needs to be everywhere. And it can't just be kind of things that are in a few places in order to have real health impacts. There are a number of guides these days and source books for integrating some of these concepts into different sectors. These are just a few that are out there. This is a tool that we developed with the regional government in Barcelona. It's available in English to help architects and designers understand the different dimensions of health for planning parks and public spaces, and how kind of they get a score on these different dimensions related to health from different designs. And then you can compare what are the features and elements of your design that will get health impacts and what spaces might be deficient. There are other tools like this, the Healthy Cities Generator, which just came out last year, which can help cities do that. And then getting citizens involved in things like citizen science, getting communities to kind of pose scientific questions, be involved in data gathering and analysis is a really powerful way to kind of understand what's happening and then ask for change. This needs to be accompanied, by a scientific partner, but there's some interesting and more researchers are being asked to include this type of method in their research, which is good because that means research is being more responsive to the needs. And then these are just a few courses that we have online. for instance, that are open and free in English that you could check out that talk to some of these issues. And then this is a study from Denver that really, through a rigorous clinical trial model, showed that community gardening had a lot of health benefits. So again, thinking in the future, how can some of these nature-based interventions be posed as things that need to be incorporated into our health system, be considered health interventions? And so for that, we need rigorous evaluations. This is another project that's trying to do nature-based social prescription. There's some places, again, in Colorado and a few other places in the United States that are doing this, where you would go to a doctor, and for instance, if you were having loneliness or mental health issues, instead of giving you medicine, they would prescribe for you to engage in social activities in nature in a facilitated way. And we're studying whether that in fact does have the ability, so that in the future, again, this would be something that an insurance company or a medical system could prescribe as an alternative to some of the treatments, and kind of relieve the pressure on healthcare systems. Because again, we need to move away from this model of only treating people when they're sick, and promoting health from the start, and maintaining healthy lifestyles. So in conclusion, we're getting to the end here. To position and promote health as an effective and entry point for transformation in different sectors, to understand that these solutions need to come from a variety of different ways and in places, but again, health can be a transversal element to that. And then I just like to end, with this quote, because really, again, getting back to the idea of individual responsibility versus, what we need governments and communities to do. Where people live the best, they don't have to actually go and make 1,000 decisions every day to try and live a healthier life. They live longer because the health is built in all around them. People in Copenhagen go on bicycle because it's the easiest and most efficient and fastest way. They don't have to kind of be making this choice and this trade-off all the time. And so these are the environments that we need to be creating for people. This is an example of, if you're interested in nature-based solutions, of some research projects going on in Europe on this. The OPLA is the repository of nature-based solutions. It might be interesting for you to check some of these out in terms of but certainly in the United States, most cities and most states have good data, and they have a lot going on as well. So it's, a matter of connecting all the agendas. For those of you who want to read about these things in a little bit of a different way, we made a comic book about it that's available for free in English, Spanish, and Catalan. You can read. And for those of you who really like 700-page books, here is one that you can also access. I have it in PDF for free. It is long, but it's all consolidated there. And with that, I think just to say thanks to our team. All this work is the fruit of an effort of a lot of different people over many years. And happy to take any questions. I might have stunned you all into silence, right?
Sorry, I was having a little trouble with my microphone. It looks like there is a question in the chat from Hans. Said, curious how Knoxville stacks up in these rankings. Looks like they haven't reached us yet.
Yes,
you might not have that particular data, but
this could be a good project for a PhD or a master's thesis project, to delve into some of these and see if you could get the data for a thesis. I would highly encourage, a lot of our work that we do is done through master's students and PhD students looking at these issues, and they make some really nice projects. So you definitely could get Knoxville on there.
Anybody else have any questions? I have a quick question. I was curious, it seems like it's a lot, I won't say easy, but a lot more straightforward to design an urban area to integrate these green spaces and blue spaces when you're kind of dealing with a new area. But how do we go back in these areas that are already hyper urbanized and integrate those kinds of spaces and those kinds of areas?
You need to recover the urban space from traffic and roads. Usually, some of the nature stuff you can do in innovative ways. You can do planting of trees. You can work on community of gardens. You can look, a lot of US cities have kind of spaces that are unused because we have more space in general, the density. So, in Philadelphia, they have some quite nice work that they've done looking at, if planting little parks and gardens and things can improve health and reduce crime. And it's true. that they found. So, it's about recovery of public space. Now, at the community level, involving the community is really important because it's easy to go with our good intentions and kind of mess things up. So, in the case of community level projects with things like parks and whatnot, it's important to get the local people involved, and because then they'll also take care of it. But in terms of some of the planning levels, yes, I mean, working with the municipal transit authorities and things to see about putting in bike lanes, for instance. I mean, I don't know, in Knoxville, how do most kids get to school?
Probably parents driving them, other than the school bus system.
Yeah. How
Definitely
did you,
not bikes.
I mean, maybe I'm dating myself here, but when I was young, a lot of people walked to school or rode their bikes to school. And, that was just a given. And sometimes it was long, right? I mean, there's the old joke, of our grandparents who used to walk barefoot both ways uphill in the snow, but that was how people used to do it. And so recovering some of these things and why have they changed? For young people, the perception of safety has really changed. And it's true that speed and the size of vehicles and the amount of traffic has really changed, but that doesn't explain the whole thing. And so why our children are outside less than ever. We need them to kind of be roaming around, and doing those things. And, a school trip is one of those examples. Like, kids have to go to school 5 days a week. They come and they go. That's 10 trips that they are automatically making every day, every week. If we could get them to do that in an active way on a bike or walking or on public transport, which, inevitably you have to walk or something, that would be a huge health gain. Anywhere in the world, you ask kids how they want to go to school, and they never say with my parents in a car. Mom, drop me off around the corner and don't try and kiss me. Let me out. No kid wants to actually go to school with their parents in a car. And yet, the way that our environment is designed kind of, I don't want to say forces that, but really kind of stimulates that model. That and the perceptions and things like we're more busy, I mean, I don't want to disconnect it from larger sociological phenomenon, right? But if we had environments, if we had school routes or programs that really could recover that would be a huge health gain right there. I mean, how many people on this call feel like, doing some of these basic things like moving sustainably, eating fresh fruit, getting exercise, getting social contact is really facilitated by their environment in a way that they don't have to kind of make sacrifices or active choices to do it?
Yeah, not at all. I think my house has a walkability score of like 3 or something.
Yeah, I mean, you have really interesting, like Walk Score. You have in the United States, there are great initiatives and people working on these things. There's a lot of brain power, there's a lot of university power, but how do we bring this home to our communities and kind of scale it up? And that I kind of come to the conclusion, I think humans are very good at innovation. And we have a lot of strategies. We know a lot about what we need to do now. And if we don't know exactly what we need to do, I'm pretty sure we're going to invent it. Especially in the US, is a very innovation driven situation, but we know a lot less about how to do it. How do we work together? How do we implement these things and scale them up? How do we get a consensus about what our city should look like? How do we get a common vision? And, the polarization, the politicization of all this stuff worldwide is super tragic. Everything is brought to court now, like whether we have trees in Barcelona, whether we have trees on our streets, we have judges deciding this, and this just can't be, right? It's really, I mean, I think we're all tired of it. But it's really been difficult, and like I said, it's a worldwide phenomenon. And people advocating in the UK, for instance, advocating for low traffic neighborhoods or restrictions on cars are getting death threats, and this is like, why are we in this situation? Because people who live in areas with pacified streets where the kids can play outside and the neighbors can talk to each other are happy when that actually happens. They usually protest at first. That's another phenomenon worldwide. Everywhere around the world, people, when you try and take away cars or limit cars, think that's going to be the end of the world. They always put up a huge fuss, and then you do it, or the brave people do it, and then people are very happy and don't want to go back. It's a bit like smoking. Nobody wanted smoking bans in the beginning. Everybody thought it was going to be the end of the world, and now nobody wants to go eat dinner in a smoky restaurant. Even smokers. So there's a lot going on there. But no, I mean, does anybody have examples or things they want to share, of what they see as their major challenges Or yeah, you live in a really great neighborhood that satisfies all these needs, and living a healthy lifestyle is super easy.
I'll at least point out that Heather asked in the chat basically that exact thing. Are there examples or are there resources that folks can use to talk to their county planning departments and encourage them to make those implementations and changes? And she said specifically with departments that may not be open to making those kinds of changes. So just echoing what you said about the culture might need a change. So
yeah. I mean, in terms of examples, we've had some success here. It takes time and patience. I think, related to this is the case about the budget. What is the incentive? Well, the incentive is that being ill costs us a lot of money, and it costs us a lot of suffering. And again, I think it's a question is we're not connecting the numbers very well together. The model that we have doesn't make economic sense. We're just not calculating it properly to evidence the full range here. One health makes sense economically, but it doesn't come out right now in the way that we're calculating things. Like how much is childhood obesity costing us? Huge amount. So what is the money to be made? Well, insurance companies, public health departments, the people who have to bear these costs, families, yeah, it's not maybe a private sector solution in the strict sense, but the benefits are there. And I think we need to be better about articulating them. These are investments, they're public investments, in the same way to say, there's not a lot of money to be made from clean air. Well, air shouldn't be something that's commercialized. Public space isn't a commercial product. That's why government exists, to protect these things, because we know individuals can't be really responsible because we tend to think first about ourselves and our family, right? And so the government needs to advocate, and this is where research needs to come in, to work hand in hand. I'm getting a little bit off topic, but I'll never forget, I went to UN Habitat in 2016 in Quito, and there was the guy who was the city manager of Montreal there, and he said, I'm roughly making up the numbers. I can't remember whether it was 15 universities in 5 miles or 5 universities in 15 miles. Anyway, the point is there were a lot of universities near him in the city of Montreal, and not once had anyone ever come into his office from those universities to talk about how they could work together to address the issues facing the city. Never. And so we don't work together in the right way. Universities are huge resources of human capacity and talent and energy and enthusiasm, and they are not connected to, what's happening. The University of Wisconsin-Madison has a great, it's called COWS. And there's another one in Seattle called Urban Lab or something, where they are trying to connect universities more intentionally. And so they have a way to connect city officials and communities to pose questions that then become the master's thesis projects, the topic of a course or a PhD thesis. And so they're more explicitly connected. And we really need more models like that, because it's a win-win. Because students need experience, students need research questions and need things, they need data, they need to investigate, and the cities need solutions. So pairing them better would be an excellent example. And like I said, you have examples in the University of Madison, and then in Vancouver is where it was. Sorry, it wasn't Seattle. Maybe they have some in Seattle, but it was the University of British Columbia and Vancouver that is really trying to link more the city with the university. Blue spaces, I would say to look at the Blue Health Project. There's less on, but that was a European Union project. I don't have a lot of the data offhand, but I would say I had the one slide on it, but I would look for the Project Blue Health. It's concluded now. But the tendency is there that it points to the same kind of health benefits that we get from green. So less evidence. You could also maybe do a search in PubMed for blue spaces in health and see what you come up with. But it's, they're getting more research, but it's an area that needs more work. Oh, and okay, safety. Yeah, safety is definitely, but that's why, again, we need changes in design to help people feel more safe. We need to address these things actively and honestly. Again, not all of it is just related to the fact that there are more cars and they're going faster and bigger. The perceptions have changed about safety, for sure.
I think there is this program. I'm not super familiar with it, but it's called like the walking school bus or something.
Mm-hmm.
And you sign up as a parent to walk a group of kids from their home
Exactly.
school.
A
And so
lot
I
of
think you
communities
just
have
sign
that
up
now.
to
It's
volunteer.
called a bicycle bus or a walking bus.
Mm-hmm.
And my only comment for that is I think that those programs are good to start, but we have to be careful because ultimately we don't want to send the message that children shouldn't be able to go alone, right? Like children shouldn't have to be supervised. I mean, when they're very small, yes, but a 10-year-old child should be able to go alone to school with their friends, which is what they really want and what they need. Like going to school is an adventure, you know? And so those are needed now because of the moment that we are, because we've gotten away from this independent mobility. But we wouldn't want, you know, because then you get into issues. I mean, I've seen some programs where even, you know, the parents have an app and they're like following their kid and they have to sign an insurance form because if something happens, who's going to be liable? Like, you know, it can kind of become something that goes kind of the opposite direction, but the programs are inspiring in the sense of, you know, in their outset, what they're trying to do is bring this awareness and get kids back walking to school collectively. Something, you know, again, which ironically used to happen organically. And now, you know, we need like special programs for it. Any other questions? Anybody thinking that they want to come and do a sabbatical in Barcelona or some of their research? Very hot here in the summer, for sure. But we have a nice view of the beach.
You're getting a few yeses, I think.
And I encourage you to look at our website. We have policy briefs. We have different tools and things. You know, you can reach out to me if you have any questions. But like I said, the planetary health and movement through the Lancet is doing some nice work as well. That's very complementary to the One Health principles. Yes. Okay, Heather, let us know. And no burning questions. I can't see you, but I hope it's been a little inspiring, maybe not too much information, connecting some dots.
No, this was really, really great, Carolyn. I don't see any other hands up or any other questions here in the chat.
Okay. Probably
Just
people
some
thinking
thank
about
yous.
lunch. Well, thank you again for the opportunity to be here.
Yes, thank you for joining us. We really appreciate the talk and certainly has significant applications here in our city as well. So you've given us a lot to think about and inspired us to get some of these green spaces and blue spaces into our areas. So thank you so much, Carolyn. We really appreciate you.
Great. And have a nice day.
All right.